Subst- Substance abuse in the workplace. Signs and symptoms. And what supervisors should know. Signs and symptoms of use or abuse include drowsiness, slowed movements, slurred speech, dry mouth, blurred vision, muscle stiffness, tremors, and reduced emotional effect or flattening. Abuse of sedatives may lead to excessive sedation, confusion, or even agitation for some people, despite the sedative nature of the drug. Risks and dangers in the workplace include sedation and slowed reflexes, which can increase the risk of accidents. Falls and machinery mishaps are common accidents associated with workers who are using sedatives. Not thinking clearly impairs decision-making and communication. And sometimes, tremors or stiffness hinders manual tasks. Overuse of these medications will often look like intoxication. And of course, you will witness reduced productivity and reliability. Minor tranquilizers are used to treat anxiety, panic attacks, insomnia, or muscle spasms by promoting relaxation and sleep. These drugs include benzodiazepines. Some of the more commonly abused benzodiazepines that most people know include Xanax, Valium, and Ativan. Signs and symptoms of overuse of benzos include drowsiness, dizziness, slurred speech, unsteady gait, memory lapses, confusion, slowed breathing, reduced coordination, weakness, and blurred vision. Abuse of these medications can cause deep sedation, disorientation, or even euphoria for some users. Overdosing on these medications can lead to respiratory depression, coma, or death. But death is more likely with major tranquilizers like clozapine, which is widely regarded as the most powerful and potentially dangerous major tranquilizer when abused. Long-term overuse of minor tranquilizers may cause cognitive impairment, such as memory issues. It also leads to physical dependence with withdrawal symptoms, if stopped abruptly. Risks and dangers in the workplace include impaired coordination and slowed reaction times that heighten accident risk. This is especially the case in driving or operating equipment. Memory issues employees experience, and confusion, can disrupt complex tasks or customer interactions. There is overdose risk with these drugs, particularly if they are mixed with other substances like alcohol. This can lead to unconsciousness or respiratory failure. And it has happened even during work hours, endangering the user and others. Dependency on these drugs often causes increases in absenteeism and also reduced alertness, which can cause errors or accidents in safety-sensitive situations. Both major and minor tranquilizers, when abused, mimic intoxication without overt signs. For example, the smell of alcohol. This making detection harder for you as a supervisor. For example, you might think an employee is drunk, but you can't detect any use of alcohol. Thank you for previewing this segment of the Drug and Alcohol Training Program for Supervisors. To see the DOT-mandated 2-hour format, click the link below to preview it. Also, get a brochure and learn more about how this program can be a web course you own, or a PowerPoint, DVD, or MP4 video. SCORM formats are also available. To reach the publisher, phone 1-800-626-4327. Thank you.